Welcome, everybody, to take part in the iCON Chinese Health Forum. How's everybody doing? I'm Barbara Ho. First of all, I would like to do the acknowledge of land. We would like to acknowledge that iCON office is situated on the traditional, ancestral, unceded territory of the Musqueam, Squamish, and Tsleil-Waututh peoples. I would also like to acknowledge that you are joining us today from many places, near and far, and acknowledge the traditional owners and caretakers of those lands. I am the Chief Nurse Officer of iCON Chinese Health Forum, and I'm the MC of today. Welcome, everybody. Welcome to the 2021 Virtual Chinese Health Forum. Take care of your health, Dementia 360. Give it a try, and later on, there will be different poll questions for everyone. And if you are joining us the first time, I would like to briefly introduce what iCON is all about. iCON is being initiated by UBC Digital Emergency Medicine. The main idea is to assist multicultural and indigenous citizens and patients and caregivers to optimize chronic disease prevention and self-management, and to provide reliable and relevant health information to citizens. We not only would like local citizens to take part, we would like to present such health information to further remote or even overseas people, so that we can work together to improve our health. And today, the topic is Take Care of Your Health, Dementia 360. Yesterday, actually, we already had held the first part. We tried to know what dementia was, what the symptoms were, what is early detection important, and what treatments could be offered. And today, we will look at can diet prevent dementia? Food is very important to Chinese people, so this is something we can look at. And also, we look at the mental health of caregivers, because usually it is 24/7 taking care of dementia patients. So let us listen to the experts. Another thing is home safety. And also to learn what is community resources, what can we do to have planning, what are pre-arranged advanced planning, and there will be different experts who will be speaking on these topics to us.
Next, we have Miranda Wong, who is our next speaker. So Miranda, she is a registered psychiatric nurse, and today I know I can see that from her PowerPoints that she has tons of information to share with us to take care of early stage dementia patients, how you can seek help, what you can prepare in advance, and what kind of role you can play. So I'm very happy to have Miranda, who can still take some time from a very busy schedule to share the information with us. So Miranda, it's your turn.
Okay. So should we begin with the objectives? Okay. So today, it is mainly to understand the role of a community mental health team nurse, and how to learn how to assess or navigate community mental health resources and help, and also to identify existing programs available for patients and or caregivers living in the community, and also to understand what advanced care planning is, which is a very important topic. So what time should we communicate so that to decide the patient to be put in a long-term care facility. So Miranda, please explain. So first of all, I would like to introduce our scope of work, our mandate. So it is for 55 years or older. And so for the elder person, the scope of activities, it will be for patients who have behavioral or psychological symptoms or dementia. They may be having aggression, and they may be wandering, and they may have mental health symptoms. And they may have depression or even bipolar. And also, there will be chronic mental health problems, and there will be complicated symptoms. And we will also take in all these patients. And there may be patients who are frail, and their physical condition is further deteriorating. These will also be targets of our patients, and then we are serving them. And we would be having a short-term psychogeriatric consultation. We have ongoing psychogeriatric assessment and interdisciplinary mental health care management. And sometimes we would refer to other appropriate services if the patient does not meet our mandate. And we would refer them to rehab programs. There would be occupational therapists or rehab assistants, or there will be recreational therapists and who can take care of them. And there may be also Bright Spot Day program or one-on-one mental health occupational therapist. So it seems that I cannot hear myself and I cannot see myself. So shall we ask for help with IT support? But anyways, let's continue. And also, though, for those clients who have been referred to our clients, then we would be having programs to stimulate their brain activities. There will be one-on-one occupational therapists assessment to assess their function, to see whether they are suitable to continue living in their own home. And we pay attention to clients who may be experiencing high stress level, and we would let them take part into a CARES program. For the CARES program, there will be scenarios so that they can learn and they can apply when they are at home, and for the caregivers to provide care for them. And there will be a hotline of 604-709-6785. You can call for referral. And there will be a continuing assessment for geriatric mental health assessment. And when we receive referrals, if it is not included in our mandate, we will refer them to appropriate avenues. So actually, for other areas, there would be similar services provided. For example, for Fraser Health, there is they have the mental health and substance use team. And for Richmond, our family physician referral would be required. And the phone number would be 604-675-3975. And the patients that we after our intake, there will be a case manager, which is very important. And you are actually, it plays an important role. And we try to understand their background. So there will be nurses, there may be social worker, or there will be outreach workers who go to their homes. And after a new intake, we will try to see the urgency, whether they have to be taken care of immediately, or we will contact the intake and to make an appointment with the geriatric psychiatrist so that patients can be followed up. And also to check on the medicine, whether there will be significant side effects. And also, we provide a lot of support and counseling to the patient. Some non-medical treatment to help increase the quality of life of the patient and the caregivers. And as the doctor, as the case manager and the family members, we would discuss and coordinate our care. And if there is a risk in the life, it is important to dial 911 immediately. And if things are not as urgent, then we can arrange to have the doctor to pay visits at home or to place them in waiting line for further care. But sometimes we have to take care of neglect or abusive action. And in this case, we would cooperate with other departments to deal with cases like this. There is a lot of coordination work. There will be a psychiatrist, and so that we can provide accurate reports. And we also would do supportive counseling. Sometimes there may be support groups to release the stress of the clients. And we place communication on a very, very important priority. So we try to enhance the coordination between people like their geriatrician. For people who are living alone, and we may contact with the building manager or to coordinate with their GP so that we could be helping the patients and choosing the most appropriate service. However, if the patient is living in a long-term care facility, then our role would be provide support so that the patients would receive professional suitable support. So actually, this is based on our reports that supports 4 different basic supports. The first one is to be done with response. So to help should be personalized. Help should be to enhance their help. And another thing, we are talking about resources. So because of time restraint, I am not talking about individual health authority. So if there would be different hotline provided by different health authorities. So about community health, for the Fraser Health, it would be for Richmond 604-675-3644, for Vancouver 604-277, 604-263-2077 after the assessment, and there will be home care services and also case management. And also they would assess swallowing, and for there will be also occupational and physical therapy. And for home care activities, like there will be simple preparation of meals to go on and off bed safely, to get changed. And also we have to take care of the social ability of patients. There are day centers for patients. There would be a small fee which is involved, and there would the fee would include a meal or a snack. And there are two places. One is on the west side of Vancouver, and usually the referral is from our department, and usually it is free. And just call them 604-875-1678. And there are a lot of community clubs which provide females or male patients with early onset of dementia, and which is Port Club, but that will be for early onset. And the phone number is 778-558-1894. There is another one called Better at Home. So this provide a lot of help for home support services, even snow shoveling. So you can call them by the number 604-268-1312. And another one is Jewish Family Services. And they also provide services to non-Jewish people. And sometimes they can give you a ride to medical appointments. And they have volunteers. The phone number is 604-257-5151. And BC, there is one big non-profit organization being Family Caregivers of BC. And they support family and friend caregivers. And for Richmond Cares, Richmond Gives, during COVID, they still provide services. For example, they have COVID shots appointments arranged, and even provide transportation. And you can go onto their website, ifo@rcrg.org. And what about meals? So there are Meals on Wheels services. For Richmond, for Western Meal, there will be MOW, Western MOW. And if you like Chinese meals, there will be Chinese MOW, Meals on Wheels. And then on North Shore, they also have the North Shore Meals on Wheels. And there will be better meal services. The phone number is 604-299 and 1877. If you live in other areas other than Vancouver, the phone number is 1-888-838-1888. And for Richmond, they are even luckier because there is a resource list, and then you can go onto the website and you can see a clear resource list. Now, we have listened to a lot on how to take care of family members. So how to take care of ourselves? So don't forget to go to your family doctor, and don't forget to handle your financial arrangement. So besides that, sometimes family members or caregivers would need to take a break. And for example, some people have to go through a surgery, and then you would need to look for somebody to take care of your patient. So for new cases, then you can call 604 822-7521. And then if you have a case manager, you can call through your case manager. And see it. So if you are near UBC, there will be another phone number for you to call. And then you can also go to our website. There is one big resources, which is the Alzheimer's Society of BC. There is a Chinese hotline, which is 1-833-674-5007. And they have individual support. And the most welcome would be what they call the Minds in Motion. So there will be resources for the patient as well as their caregivers. So make sure you give them a call. And many a times, many people have forgotten that elderly people can be abused or neglected. And there is a report in our office. So in the province of BC, about elder abuse and neglect is over 40%. So we have to pay attention that elderly persons can be easily abused and neglected. And there will be a lot of risk. So if you face immediate risk or danger, then of course dial 911. Otherwise, you can call a hotline called SAIL, S-A-I-L. And the phone number is 1-866-437-1940. And for Vancouver, 604-437-1940. So their time would be from 8 in the morning to 8 in the evening. And you can also go onto their website. There is a Chinese translation too. And there is the hotline, the health hotline, 811, which offer information in multiple languages. So let's go to advanced care planning. So it seems like a will, which is offered.
This is something that you should do when someone is alive. And so in 2011, on September the 1st of 2011, there is legislation in BC for BC citizens, residents, that if they can make advanced care arrangements so that they can act according to our wishes. Okay, so there are many plans in the course of life. So planning such as health or financial affairs, or just legal affairs also. So we can also make advanced planning for those. When we do that, it's very simple. There are three parts. There are three processes. So what are those three aspects? So what matters most to you? Who can have personal care decisions for you if you cannot? So then you should discuss your thoughts with the people you trust and your healthcare providers, and then plan according to your wishes. And so you write down your wishes and you plan, and give the people you trust a copy, as well as your care providers, a copy. So we have to do ongoing assessments, because we have to tailor our plans according to what's happening around our lives and those changes. So whenever there are changes, you should revise those plans and give new copies to those you trust and to the healthcare providers, so that they have a copy of the plan in hand. In British Columbia, so the advanced plan planning should consist of the following. So you should have a conversation with your family or friends and healthcare providers about your beliefs, values, and wishes, and have a written record or video of your beliefs, values, and wishes for your future healthcare treatment. And also, there's something called My Voice. My Voice, you can download that webpage to find out more information. And what you need, we need to have the decision makers' full names and contact details. In British Columbia, usually it's the spouse or the children, or even parents who act as the decision makers. So if you have not written down those, and it will delay your time for getting treatment. But if there are things that you don't want someone else to make decisions on your behalf, you should write those things down too. For example, for medical matters, you should find someone who respects your wishes, who share the same value system with you, to make those decisions with you. And those people should be able to do that. So they will also deal with conflicts and disagreements. They will be willing to assume that role, and they will communicate with you and protect your interests and be your advocate. But there's so many delays that I cannot find those slides. Now, in British Columbia, only a way to get someone who make decisions on your behalf is making a representative agreement. There is some power of attorney, but there are limitations to the power. So for someone to make decisions for you for financial and legal matters, let's look at the next slide. In British Columbia, there are 4 choices for you to make that. You can draft a Section 7. There's the Standard Representation Agreement. There's the Enhanced Representation Agreement, which is Section 9. There's also the Advanced Directive, and there's also the Enduring Power of Attorney. So what are those things? All right. So if you are capable to and know what you're doing. So what do you mean by capability to understand? That is, you understand the nature and the effect of the documents. So, for example, in Section 9, the Representation Agreement, it says that they can make decisions on your behalf for your healthcare and personal care directives. And there's the advanced care. These advanced care directives, and there's the enduring power of attorney. Some people say that I don't need that because I only need someone to make decisions for me for minor affairs. Then you can draft a Section 7 document. Right. A Section 7, so if you need someone to help you, you can draft that up to deal with simple healthcare matters, personal care matters, or even financial and legal matters. But they cannot make decisions on your behalf to refuse or to accept on your behalf in terms of maintaining care to sustain your life. And another thing is we call advanced care directives. It's also a legal document you can discuss with your family, with the authorities, whether you want to accept or refuse certain treatments, for example, resuscitation, or even feeding you. This kind of legal documents, you need two people to sign. If you do that in a notary public's office or a lawyer's office, you only need one person to sign other than the lawyer. So that should be in your plan. Now, these are legal documents. So there are websites where you can find more information from for simple matters. But if there are complex issues, you should go to a lawyer's office to consult them. So there's also a NIDAS website that publishes Chinese literature on Section 7 and Section 9 documents. So you have the time for that, just visit that website. Finally, you may want to ask, I have done everything that I can to help the patient, but when should I decide, when should I consider that a nursing home is appropriate for my loved one? So let's look at that. So now we have family and friends, community and person, and if everyone has done their best to help the patient to remain home to receive care, but for the safety of the patient, we should consider moving to a facility. So we can move that person to a private facility or facility that is managed by the health authorities. There are two ways. There are two types. There's the assisted living and there's the long-term care. So you can, there are telephone lines that you can consult them from. So what is assisted living? So the eligibility for that is that you have to be able to receive home and community care services, be able to direct their care and make decisions, be able to communicate and be understood by others. And in cases of emergency, you're able to make appropriate responses, such as fire alarm. You know what to do when there's a fire alarm, right? And also you will not do things that can harm yourself or harm your family members. So if you cannot help your patient in those aspects, then maybe this person is the right candidate for a facility. And there's another facility called long-term care. So we talked about safety. So if someone is prone to falls or aggressive, or we have done our best, either using medications or not using medications, still those issues often happen. So it would be appropriate to move them to a facility. And maybe it's reached a stage where you have to help them, support them, to transfer them from bed to toilet and from bed to other places. Then you should consider moving that person to a long-term care facility. And maybe after that person has suffered a stroke, then you don't have alternatives. Or after a fall, you don't have any alternative. Or after a surgery, you have not fully recovered from the surgery, or self-neglect. For example, the sleepwalking, or someone just walks in the middle of the sleep outside to do something silly. So maybe incontinence or things like that, or scatolia, that will increase the stress on the caregivers, that may affect their marriage, that may affect the caregivers' own health. Then we should consider moving the patient to a facility. So the main thing is we are helping and not giving up. Yes, if we need to move the patient to a facility, then there are phone numbers that you can call. Now, I want to pass the mic back to Barbara. Wow.
And we thank all the audience to pay attention to our program and to listen to all the specialists giving a lot of information. I would like to acknowledge a few of our partners. I would like to thank BC Health Ministry because of their support. And therefore, our iCON has been in operation for 13 years, and this is our 14th year. A lot of gratitude to them. And this one, please go to BC Health Ministry and go to the booth. So there is one which is the guideline for seniors, and you can download for them Seniors Guide, and they are in English and in Chinese. Two different versions. So please go and take a look. And then another slide, please. And there are a lot of community partners like Success, which is very important, and Alzheimer's Society BC. We have a lot of support for them. Vancouver Coastal Health and Canadian Health Association, Canadian Health, British Columbia, and Villa Cathay, and Richmond Cares, Richmond Gifts, who is helping us. And there is a lot of media partners, Fairchild, Ming Pao, Sing Tao, Talent Vision, Fairchild Radio, South Vancouver Neighborhood House, Diversity, and IMC, and also Akawa Health Forum. And finally, I would like to give thanks to the health exhibitors. So remember, these health exhibitors are on for 1 month, and you can go through the Success, Alzheimer's Society, just like what I've said, the BC Ministry of Health, Family Givers, RCRG. I would like to also say Success and Alzheimer's Society. They are offering another forum, and then from our exhibition forum, you can find a poster. This is the one. So you can take up your phone and then take a shot of the QR code. If you're interested, I think there will be a lot of information to present to others. And finally, I would like to express our thanks to our guest speakers again. And you have been attracted by their excellent speeches. Dr. Tygerson Young, Wendy, our registered occupational therapist, Jojo Wang, registered dietitian, and Miranda Wong, community psychiatric nurse. And so the information is excellent and abundant. And we would like to thank C2 Sky Christina and her team to organize this virtual forum. Thank you very much for their technical support. And there are a few interpreters. So when you listen to the Chinese or the Mandarin, so you can listen to Shiny Tan Susan Yao. For English is Josephine Soa and Benny Loy. And thank you for the enthusiastic interpretation. And thank you so much. And finally, I would like to thank iCON team. Actually, behind the scene, there is Susanna Ng, there is Joanne Rockwood, and Ring. They have been doing a lot and having a lot of support to us. And there are many other volunteers behind the scene giving us a lot of help. And finally, I would like to thank Barbara. You have seen her performance in the past 2 days. So not just those past 2 days, there was a lot done by her preparing for the forum. And the most important, I would like to thank all of you, audience, because when you come to this forum, it's because you take very important perspective at your own health and the health of your family. And we really do wish that we have helped you to know more about dementia. And we do hope that we are going to hold more workshops on different topics. And we know that there are a lot of questions regarding dementia. We are going to hold a specific workshop answering all those questions. So please go on to our website, keep track of our development, and then you will be notified if you have already registered. And for online, I have to say goodbye for the time being, but I know we are going to have a good time down the road, and we are going to use time to help yourself and help each other so that we can live a very vibrant life. Thank you. Bye.